So this is an illustration of forehead and facelifting incisions, and the whole idea is to camouflage these incisions in natural anatomic areas. The important thing with the hairline is that women generally tend to have two tufts of hair. A tuft of hair, temporal hair here, and a second tuft there. This is her forehead incision well behind the hairline, so it'll be totally camouflaged. So to maintain this temporal tuft of hair, I measure 2 centimeters in front of the root of the helix of the ear, and so I want my incision to be behind that, because this whole flap of skin will come up this way. If you make an incision back here, this hairline may wind up way back here, and you lose this temporal tuft of hair. So I like the vertical limb hidden behind this anterior hairline. Some people make the incision right in the hairline to maintain this entire temporal tuft of hair. Problem with that is there's a transition that's easily visible between this skin and the scalp skin. It's different texture, so you can actually see the incision more. This is going to be totally hidden. This incision is hidden behind the tragus. There's a little dart right there to form a depression in front of the tragus, like we all have. And then this incision back here, we look and see where the ear meets the postauricular hairline, and it's right there. That's the top of my incision. Then this is going to be extending down the hairline this way, and this will be a sawtooth incision, because as you can see here, this hairline is not straight. It's irregular, like every single hairline is. And if you make a straight incision, what happens is you have a straight layer of hair follicles here, which looks a little surgical. So by creating a sawtooth kind of a pattern, we'll maintain this irregular hair. The same way we do hair transplants up here. We don't make a straight hairline, we make a sawtooth irregular hairline, and that'll be the same down here. Now, if you make the incision, if you extend it from here back to here, what happens is the flap comes this way, and this part of the hairline will be back here. This part of the hairline will be up front, and there will be a step off. So it'll be like this: hair here, no hair here. Be a step off between the two. And the problem with that, to avert that step off, you have to lift the skin up here vertically to match the hairline. When you do that, these wrinkles then look like pleats that come up this way, and that's not natural. The natural line of the neck wrinkle is in this direction, and we want to maintain that. By making an incision here, we maintain that, and there's no step off in the hairline. So that hairline incision, even though it's going to be longer, will be less visible, and we won't have any step off. We'll be able to get some of this neck skin out that way, because of the vertical lift here will line up the hairline there, and we don't have to worry about pleating from here. But if you come this way, then you have to bring the flap up here, and you get these curvilinear pleats of skin going up this way, which has a facelift kind of look to it.